to treat acne, we have one topical and one oral medication that are FDA approved. And there's more, but unfortunately those are the only ones. We have topical clascoterone, which was recently approved to treat acne. And we have oral contraceptive, combination oral contraceptive medications, which are also FDA approved to treat acne. Clascoterone is an anti-androgen. It actually competes with the androgen receptor. It's a steroid type hormone and competes with the androgen receptor as well with testosterone and dihydrotestosterone, especially DHT, which is much more potent than testosterone. So clascoterone works in that method. It's rapidly metabolized to a much less active steroid metabolite, so that way we don't have high levels of androgens building up in the blood. So it's an inactive metabolite. But it's been shown to reduce inflammation, inflammatory lesions, as well as comedones in acne in large phase 3 trials. So it's a twice-a-day product, and it does work. Now, people don't always use it as monotherapy. That's a whole other subject. But that's the main, I think the only FDA-approved medicine for acne that's anti-androgen, and that is a topical. Dermatologists don't usually use oral contraceptives by themselves alone. I mean, in clinical trials, I think it's been shown to reduce acne maybe 50–60%, which is not good enough for us. So we use in combinations with other orals and topicals. And combination oral contraceptives work in a few ways. There's the ethinyl estradiol component, and that's an estrogen. And estrogen increases sex hormone binding globulin, and that helps soak up extra circulating and bind circulating androgens in the body, so there's less free testosterone. Acne can improve on that way. They also have a component besides the ethinyl estradiol component. There's a progestin. There's multiple progestins that can be used, but those also bring down androgens by inhibiting ovulation, or lessen acne. By inhibiting ovulation, they work against LH and FSH. So two ways birth control pills, combination birth control pills, oral contraceptives, can help improve acne. Then it's spironolactone, which is used off-label for as long as I can remember to treat acne, for a long, long time. And we use it in doses of 50 to 100 milligrams a day. And you know, one study I reviewed showed 100 milligrams a day is the most common dose. I start with 50, but most dermatologists start with 100, and that can be done once a day or 50 milligrams twice a day. It's done both ways. Spironolactone is most commonly used with retinoids. Why, I don't know, because theoretically spironolactone, being an anti-androgen, can reduce acne on all different facets, comedones and inflammatory lesions. And I usually use it in combination with a retinoid and sometimes even a benzoyl peroxide. But most dermatologists do like me, they use it in combination, although theoretically that's not necessary. Which is different than oral antibiotics, which we must use in combination to prevent resistance. So spironolactone theoretically doesn't have to, but we're so used to combination, we do it, and I think it works better, but I don't have there's no studies that show that. But spironolactone is, like I said, 100 milligrams a day is the most common dose among dermatologists. And spironolactone is a DHT inhibitor, but it also works in multiple other ways. It works like ethinyl estradiol and helps reduce free testosterone by increasing sex hormone binding globulin. And spironolactone also binds the nucleus to reduce androgens as well. So multiple ways that spironolactone works to improve acne.